What I really love about our team is that we are very collaborative. We share a lot of our cases, and there's really a very low threshold for us to share and ask questions. Even if we just get a weird vibe of a case, we'll show it around, make sure everything is good. And this type of collaborative environment, I think, is extremely important because it really makes sure you are getting the right diagnosis for every patient. For Dr. Keiser, she has a wealth of knowledge of pretty much any tumor under the sun. Something is difficult, wild, weird, something I've never seen before, she has the answer for it. She knows how to work it up and everything to do for it, and I really appreciate that so much. Dr. Wells has been doing this for a few years now, and he has a wealth of clinical experience. Any rash case, really anything challenging, but he's specifically good with like correlating the clinical picture with what is going on that slide, and he always knows the answer. So I just really love working in this group. It's a great team.
Dr. Scott is amazing because she's very thoughtful, she's very well trained, and she makes sure that we give the best care to our patients. And I really value her as a colleague and bouncing ideas off her. I'm grateful for Dr. Keiser because she cares a lot about patients. She's incredibly knowledgeable, and she comes from a different background than Dr. Scott and I, in that she trained in pathology as opposed to training in dermatology. So it's good to get that perspective to give our patients the best care possible. They're both really intelligent, super bright, kind people.
Just today, I'm actually really excited to say that yet again, Dr. Wells nailed a really difficult diagnosis. We had a case that involved cells back to back. They looked epithelioid, but there were also scattered mitoses. So this was a very atypical case and concerning for at least an intermediate level malignancy, if not something worse. I have to say, per usual, Dr. Wells nailed it. We looked at it interdepartmentally and ultimately decided that we would like additional workup, and he sent the case out. And just today we got the report back and he got it right on his first guess. So he has been a wonderful resource for me to be able to show things, and has, although I've only been here a short amount of time, he's also been teaching me more about PRAME. One of the things that I especially like about Dr. Scott is that occasionally, deep down, I'm maybe a little bit embarrassed to be showing a case that I feel many people could feel is straightforward, but that I still have a question on. And ultimately, if I still have a question on a case, my ego is going to take second tier to making sure I'm getting as good of a diagnosis as possible. So what I love about Dr. Scott is she has never looked down on me for asking for this help, even when I've said I'm a little embarrassed to be checking this. She's always been really welcoming, supportive, and also gently helped teach me how to approach it even better the next time.